Hello everyone, this is Dr. Poornima Srinivas, owner and founder of Hills Dental Design, where healthy and beautiful smiles begin. So what we're going to talk about today is what happens in your second consultation. So you had your oral scan and you had your CBCT. Remember, that's the diagnostic tool we need to understand whether your bone is the right bone, whether we have enough space to put the implant, and how we are going to actually look at the crown and the prosthesis, how we are going to manage and design the prosthesis. So we've got that information, and now we have called you for your second consultation. During the second consultation, you can have a look at the design of the prosthesis. You can change, for example, we can talk about how many implants you need, and we can change the design if required. We are also going to be talking about the costs and your upcoming implant appointment. So let's have a look as to what exactly you see in your second consultation. So remember, we actually use the digital technology these days to come up with your planning. So there is absolutely no confusion or any sort of, guesswork. So you can actually you can see what's going on. So this is actually what we talk about, what we come up with, the planning. Okay. So here what you see is a lower mandibular jaw, and we're looking at how many implants we can place. So here is your CT scan. So we actually see, well, basically what we are going to do, whether we are going to have, where the implant is going to be placed. So the green color here is the implant, and the red color, which you can see, is actually where the nerve is. So we want to make sure that we are away from the nerve, because as you know, we don't want to put an implant in the nerve space. So that's, categorized as a big red. So we both know where your nerve is. And then what we're going to do is, this is a cross section as well. So basically what we do is a cross section here where we say, well, this is where the implant is, that's the width of your jaw. So that is a cross section. And then followed by, this is the actual sort of cast, that's the oral scan. So the yellow part is the oral scan for you. So that basically, it shows us where exactly the implants are going to be placed. You can actually see your teeth as well. And that gives you an understanding about where the implant is placed, because what I like to do is I really like to get my patients involved and for them to understand, how the prosthesis is going to look. Now, for example, being a woman myself, I would love to know if like a surgeon or a practitioner can actually sit and talk to me and tell me, well, this is how it's going to look. So I can visualize the final prosthesis. That would be fantastic. Because before, what we used to do is we used to do surgery. Surgery was only done where the best bone was available. And then we have to worry about the crown. How are we going to place the crown? And then we had to, use some special techniques and tilt the crown or make it sort of, more aesthetically pleasing. It was more surgery based, but now these days it's more prosthetic based, which means that we know where the crown should be and where we would like it to be, and then we'll say, this is where I would like the implant to be. And that is what the digital planning helps. The digital planning really helps, because we can actually do it so accurately, and we're also going to be doing like a non-surgical procedure. So this is what we're going to show you. So when you come to the practice for the second consultation, we are going to show you how many implants are we planning, where the prosthesis is going to be, how it's going to look. So you have a full model, the digital model of your mouth with the final prosthesis in place. And if you want to have a say, you can definitely, we can sort of, tweak the plan for you if you like. When I say tweaking the plan, we talk about whether an overdenture is better for you or we go for the crown and bridge option. Sometimes we can do both, but the patients, are driven by, the cost factor, because the implants are a little bit expensive. So people sort of, look at, okay, can I do this? Can I do that? And it's just a really good consultation. So both of us know where we are going, where to go ahead, and how to go ahead with the next appointment. So then we follow with the next appointment, and the next appointment normally is the surgery itself. So with our next Facebook Live, I'll be talking about how we do the next appointment. That means we do a non-surgical guided surgery wherever possible. So what does that mean to you as a patient? So join me next Tuesday and we will talk about like a guided surgery, which is a non sort of, we don't open a flap, there's no bleeding, there's minimal fuss, and that's the way to go where if we can do that surgery for you. So thank you for watching. This is Dr. Poornima Srinivas from Hills Dental Design, where healthy and beautiful smile begin. We are offering a free consultation this month. So if you would like to know more about implants, do feel free to call us on 94841913 or email us at info@hillsdentaldesign.com.au. We are here to help. Thank you. Bye.